Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to dissolve blood clots in legs. Deep vein thrombosis, DVT, occurs when a blood clot forms in a deep vein, typically in the legs. Treating a DVT is crucial, as the clot can break loose from the affected vein, move through the bloodstream to the heart, and lodge itself within the lung's main artery. This complication, what's known as pulmonary embolism, can be fatal. /r/n/r/n blood-thinning medications called anticoagulants are essential for preventing pulmonary embolism after a DVT diagnosis. Other therapies like taking a clot-dissolving drug or placing a device near the heart to trap blood clots are considered in select clinical scenarios. /r/n/r/n This article will explore the treatment of DVT and the management of postthrombotic syndrome, a common DVT complication. Supportive remedies, like early ambulation and compression stockings, will also be briefly reviewed. /r/n/r/nOliver Helbig Getty ImagesrnrnRn/Home or natural therapies like compression stockings are intended to be supportive and not therapeutic when it comes to DVT care. Medical treatment is vital to treating DVT and helping prevent pulmonary embolism, among other complications. /r/n/r/n The cornerstone of treatment for deep vein thrombosis is taking an anticoagulant, also known as a blood thinner. /r/n/r/n In select cases, other options may be considered, namely administering a powerful clot-busting drug, thrombolytic, or placing a filter near the heart to help trap clots traveling up from the legs. /r/n/r/n Anticoagulants do not dissolve blood clots. Instead, they impair clot formation, giving the body's fibrinolytic system time to lyse or degrade the clot. /r/n/r/n The primary reason for taking an anticoagulant for a DVT is to prevent pulmonary embolism. Other goals include /r/n/r/n Anticoagulant agents to treat DVT include /r/n/r/n Selecting an anticoagulant regimen depends on several factors, including /r/n/r/n Thrombolytics dissolve clots by forming an enzyme, plasmin, that degrades the fibrin, strands of protein, that hold blood clots together. /r/n/r/n Thrombolytics can be administered in two ways. /r/n/r/n The drawback with thrombolytics is that they carry a risk of significant bleeding. They are reserved for high-risk cases, like extensive proximal, upper leg vein, blood clots or people with phlegmasia ceruleus dolens, PCD. /r/n/r/n PCD is a severe complication of DVT associated with extreme leg swelling, pain, and a bluish-purplish skin discoloration. It results from a massive blood clot that blocks blood flow through the affected leg. /r/n/r/n An IVC filter is a small wire device placed in the inferior vena cava to trap traveling blood clots and prevent pulmonary embolism. /r/n/r/n The inferior vena cava is a large abdominal vein that returns oxygen-poor blood from the lower half of the body to the heart. /r/n/r/n IVC filters do not prevent the formation of new clots and are not nearly as effective as anticoagulation in preventing pulmonary embolism. That said, sometimes they are the next best and only option. /r/n/r/n An interventional radiologist usually performs this procedure as an outpatient. This minimally invasive procedure involves guiding a catheter with a collapsed filter mounted on it through a cut in the groin or neck. /r/n/r/n Once in place, the filter opens, imagine an umbrella, and the catheter is withdrawn. The filter anchors itself to the wall of the IVC to trap blood clots before they reach the heart while still allowing blood to flow freely. /r/n/r/n Indications for IVC filter placement include, /r/n/r/n Anticoagulation is started immediately after a DVT is detected unless there is a clear contraindication, such as active or high risk of bleeding. /r/n/r/n The specific duration of anticoagulation depends on a person's risk of developing another blood clot. That said, anticoagulation is generally given for a minimum of 3 months. In some cases, it's continued for 6 to 12 months or even indefinitely. /r/n/r/n Providers use various tools to help predict blood clot recurrence risk. A person's risk of major bleeding is also factored into the decision regarding treatment duration. /r/n/r/n Postthrombotic syndrome is the most frequent complication of DVT, manifesting in 20% to 50% of people within 2 years of being diagnosed. /r/n/r/n It's a form of chronic venous insufficiency that results from the damage caused by the blood clot in the affected leg vein. /r/n/r/n Typical symptoms include /r/n/r/n The key to preventing postthrombotic syndrome is to take your anticoagulant therapy precisely as instructed and to follow closely with your provider. /r/n/r/n If postthrombotic syndrome does develop, management strategies include the following: /r/n/r/n Sometimes, a venous return assist device, a compression pump worn on the calf to optimize blood flow, may be considered. /r/n/r/n Various surgical procedures like stenting, placing a tube in the vein to improve blood flow, can also be performed on people with severe symptoms. /r/n/r/n Early walking after being anticoagulated for a blood clot in the leg is strongly encouraged to prevent postthrombotic syndrome, increase quality of life, and decrease leg pain and swelling. /r/n/r/n Elastic graduated compression stockings are also sometimes worn for up to 2 years after being diagnosed with a DVT. However, keep in mind the research supporting their benefit in preventing postthrombotic syndrome is mixed. /r/n/r/n Besides preventing postthrombotic syndrome, early ambulation and wearing compression stockings during situations that pose a high risk for developing leg blood clots, for example, after surgery and during air travel, respectively, can also help prevent DVTs. /r/n/r/n Other lifestyle habits to help prevent DVTs include /r/n/r/n Certain medications are also linked to a higher DVT risk. For example, birth control pills and hormone replacement therapy, estrogen or estrogen and progesterone. /r/n/r/n If you have a personal or family history of DVTs or clotting disorder, be proactive and speak with your prescribing healthcare provider before taking any new medication to ensure it is safe and appropriate for your care. /r/n/r/n Certain herbs and supplements, for example, turmeric, ginseng, and vitamin E, are known to have blood-thinning properties, although their ability to help prevent blood clots remains unknown. /r/n/r/n Moreover, these and other herbs or supplements can interact with medications, including blood thinners, so they should only ever be taken under the guidance of a healthcare provider. /r/n/r/n Ultimately, natural remedies should never substitute medical care for a blood clot in the leg. /r/n/r/n A deep vein thrombosis, DVT, is a blood clot found in a vein, usually within the leg. The primary concern with a DVT is a potentially life-threatening complication called a pulmonary embolism, when the blood clot travels through the bloodstream to a major lung artery. /r/n/r/n Taking an anticoagulant, blood thinner, is the mainstay treatment for DVT. Anticoagulants can help prevent pulmonary embolism, new clots from forming, and other long-term DVT complications like postthrombotic syndrome. /r/n/r/n In select cases, for example, a person cannot take an anticoagulant due to active bleeding, a small device called an IVC filter is placed near the heart to prevent blood clots from traveling to the lungs. Less commonly, a clot-busting drug called a thrombolytic may be administered. /r/n/r/n supportive or home remedies play a complementary role in treating DVTs, namely early ambulation after starting anticoagulation. Lifestyle habits like wearing compression stockings during extended travel, maintaining a healthy weight, smoking cessation, and staying active can also help prevent DVTs. /r/n/r/n A healthcare provider must evaluate all suspected blood clots. If a DVT in the leg is diagnosed, anticoagulation is vital to preventing it from traveling to the heart and potentially causing death. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.